Welcome to the program. I'm your host, Neil Howard. Glad that you could join us here today on Health Professional Radio. Our guest is Dr. Martha Sajatovic. She's going to talk about a drug that has the potential to reduce rates of incarceration for patients with schizophrenia and bringing hope to breaking that cycle of hospitalization and incarceration. Welcome to Health Professional Radio today, Dr. Sajatovic. How are you?
I'm good. Thank you. Thank you for having me.
Well, first of all, very briefly, who is Dr. Martha Sajatovic? What do you do and where do you do it?
Well, good question. So I am a professor of both psychiatry and of neurology. I'm at Case Western Reserve University School of Medicine and also University Hospitals of Cleveland in Cleveland, Ohio.
Now, I understand also that you're a lead investigator with the PRIDE study. Can you tell us what the PRIDE study is?
Yes. So the PRIDE study, a very exciting and, in my opinion, important project, was a clinical trial, so a research study, which looked and specifically enrolled people who had a history of incarceration, being in jail or prison, often as well as one of the complications that people with schizophrenia certainly can have. And as you can imagine, it definitely contributes to a poor outcome. So basically what the study did is it enrolled or recruited people with schizophrenia who had recent incarceration or problems with the law, and then they were randomly assigned, so basically kind of flip of the coin, done a little more complicated than that, but basically that's the gist of it, to receive either a once-monthly injectable antipsychotic medication. It was a medication called paliperidone palmitate, versus antipsychotic medication that people take, with pills. And so the study went for 15 months, which is actually pretty long for this kind of research study. And the primary outcome, or what the researchers were really interested in looking at, was how long it takes for people to basically get in trouble or have a treatment failure, either being arrested again or incarcerated or being hospitalized, stopping treatment, kind of the variety of real-world outcome stuff that I think everybody would agree is bad for people with schizophrenia. What the PRIDE study showed is that the injectable medication was associated with better outcomes, so people were less likely to have those bad events or treatment failures. And that's a very important finding. These long-acting injectable medications are available currently. Clinicians have access, so it really kind of opens up the door to us thinking about using these medications in people who, just are not doing well or might have a poor prognosis.
Now, the injectables are administered by the healthcare professional. It's not left up to the patient to comply. That is correct, right?
That's correct. People do need to come to a clinic and get the medications, although sometimes, some clinicians or health systems do outreach where they can have a visiting nurse, for instance, come in and give medicine. And that's very exciting. It gives it a lot more flexibility. People don't have to worry about taking medications every day. And then if there's a problem, the health professional is there and that can be addressed right away.
What is it about a patient with schizophrenia and incarceration for whatever reason, committing some, criminal act or being a danger to themselves or to others? I guess they wouldn't be incarcerated. I guess they'd be hospitalized, but I'm not a lawyer. I don't really know. So what is it about schizophrenia specifically that raises this interest in the cycle of incarceration as opposed to someone who's just a career criminal?
Yeah, so schizophrenia is an illness that usually happens early in life. So people get it in their teenage years, usually, or early 20s. Maybe mid-20s, although it can occur later on for the first time later in life, but usually it's young people who often have not had an opportunity to get their education in, to accomplish any life goals. So, now they've got this illness which tends to be chronic. They often can't complete their school. They may have difficulty getting jobs because of their symptoms. They have a hard time with social interactions. So now it's hard for them to work, to establish relationships. They may start using substances, and you can kind of see where that's going. When people start to accumulate sort of difficulties in their life or challenges, then it's much more likely for them to fall into legal problems. And unfortunately, we see, if we look at incarcerated populations or our prison system, we tend to see a lot of people with mental illness and definitely with schizophrenia as well.
Now, you mentioned that it presents early in life. Are we talking pre-adolescence?
That can happen. I mean, there are childhood onset versions of this condition, but most of the time it would be as people are kind of entering adulthood. So, college, young adults, they might be young service members if they've gone into the military. So that tends to be the very vulnerable time period.
Did the study lend any insight into earlier proper diagnosis when it comes to schizophrenia? I mean, if it's onset that early in life, I'm sure there is a period of misdiagnosis or no diagnosis whatsoever.
Well, the average age of people that were in the study was around 38 years. So these were, people who were a little bit older, and because of the study inclusion criteria, in other words, the requirement for being enrolled in the study, a person would have already had to have had some history of incarceration. So actually, according to the protocol or the set of procedures, people would have had to have been taken into custody in the criminal justice system at least 2 times in the previous 2 years. So that kind of steers you away from being able to say very much about very young people and kind of early intervention based on the findings. But we do know from other work and other research that's out there that the sooner you can identify schizophrenia and the sooner you can get people into comprehensive treatment, the better their outcomes. This study compared basically the formulation that's given as a long-acting injectable, so once-a-month treatment versus daily oral treatment with other, also FDA approved, and this medication is FDA approved. So what really is the clincher here is that getting once-monthly injection probably helps people stay on track and improve what would be otherwise a poor prognosis compared to having to take a medication once or twice a day.
So that directly relates to the compliance issue, which seems to be a huge problem, especially in mental health patients.
It is, and in schizophrenia in particular, what we are learning increasingly is that people with schizophrenia have problems with what's called their cognition, sort of their ability to process information and kind of sometimes to solve problems or pay attention. There's a variety of kind of more subtle cognitive impairments that we see, and so that makes it harder to stay on track with medications.
How has the government viewed the study, if they view the study at all, in dealing with those who are incarcerated in various facilities around the country?
Well, I think that remains to be seen. So this medication got this FDA approval to include this in the prescribing information or the package, so it's there. Now how that information plays out in the real world, I think remains to be determined. But I think what's particularly remarkable about this study is that it was done. In most research studies that treat people with schizophrenia, they would absolutely exclude this kind of research study participant. So somebody who's not taken their medicines or has had legal problems, somebody who has substance use problems, those people would be specifically excluded from the typical research studies in schizophrenia. Here now we have some research information in a real-world population that I think we can use to try to understand, what is the potential implication for clinical care. And then potentially, payers might get involved, government entities might get involved to say, how can we support what we know here.
Well, I appreciate you talking with us today.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at healthprofessionalradio.com.au and hpr.fm.